Hi, this is Dr. Neha Pawar. I'm a consultant obstetrician and gynecologist with Kokilaben Dhirubhai Ambani Hospital, Mumbai. I'm here to discuss with you today the implications of the ongoing COVID-19 pandemic on women's health. The COVID 19 pandemic, as we all know, has put an unprecedented demand on the entire healthcare system. And though men are more likely to develop the serious consequences because of the infection per se, women are more likely to bear the brunt of the social and the economic consequences because of the pandemic. The lack of access to regular health care has already landed up a lot of women with a lot of complications. The lack of access to family planning and safe contraception has landed them up with unwanted pregnancies, and naturally, that increases the number of unsafe abortions that we see nowadays. The birth rate is also expected to rise, and though the infection per se is not shown to be more serious or more common in pregnant women, nevertheless, pregnant women do come in the moderate risk category. There is very little chance that the infection would pass on from the mother to the child, but the fact that there would be fewer antenatal visits, there would be lack of access to safe delivery options, means that in the long term we might see a rise in the number of complicated pregnancies and the maternal deaths and neonatal morbidity associated with it. Moving on to the geriatric or the elderly patients, we are unfortunately seeing that the elderly women are suffering a lot because of the lack of access, easy access to healthcare. So, and the fear of moving out of their homes, because of which they sit at home with complications, issues as mild as urine infections to as serious as fractures. There's a delay in diagnosis of many cancers because they sit at home because they're afraid to reach the hospital. Mental health issues are also on a rise. Domestic violence is on a rise. The excessive information or other misinformation on the social media, we are seeing more and more cases of anxiety, insomnia, depression, and of course, suicide. So, my advice to all my women patients out there is that do not sit at home with any major health issues. If you are sick, you need to approach the necessary healthcare provider. Uh, it's becoming more and more obvious that we're going to have to live with this virus now. This has become the new normal. As the lockdown is easing out, it is easier to access healthcare now. A lot of your doctors are also available for virtual consultations, so make the most of it rather than opting for self medication through Google. If the condition is serious enough to not be managed at home, then please do take the time and the effort to visit your nearest healthcare facility, for especially my elderly patients. If you are suffering from any prolonged urine infections or any fractures, or if you have any bleeding after menopause, or if you have are feeling any breast lump, then please do approach your medical health provider at the earliest. Pregnant women should take due care, stay away from crowded places, stay hydrated, monitor your blood pressure because there is a chance that the hypertension or the clotting in the veins might increase because of COVID 19. So stay in touch with your healthcare provider. Let them know at the earliest if you have any symptoms of cold, cough, breathlessness, or fever. Breastfeeding mothers, even those who are suspected or positive for COVID 19, the recommendation is that please continue breastfeeding your child because the benefits of breastfeeding outweigh the risk of transmission of COVID 19. So, exclusive breastfeeding, rooming in, skin to skin contact is very important unless you're so sick as to not be able to breastfeed, in which case you should opt for expressing the breast milk or wet nursing till you feel better. Have a regular and a systematic routine in which exercise, even if it is indoor exercise, is a part of the plan. Have a healthy social network with friends, neighbors, family, so that your anxiety levels stay at bay. Stay well informed, stay safe, and reach your healthcare provider at the earliest for anything which is abnormal. We are always here for you. Take care. All the best. Thank you.